In a time when the United States is leading in the coronavirus cases around the world, and the situation is continuously deteriorating in the United States, the fight against coronavirus is getting serious and very important. And the frontline warriors are the people who are working in the hospitals and the people who are the healthcare workers. So we have today with Dr. Fatima Syed, who is a hospitalist in one of the hospitals in the state of Maryland, and we're going to talk to her about what kind of precautionary measures are being taken in this time. Thank you, Dr. Fatima, for giving us time. So tell us about, in the situation right now is pretty bad, as the US is leading in the number of coronavirus cases around the world. And at this time, what kind of precautionary measures are being taken at the US hospitals?
Well, Saket, let me start off by saying that it's a completely different world in the hospital and around, the whole world, obviously. Since the last 2 weeks, things have just accelerated. Every day is a different day for increasing precautions and coming up with new ways as we learn more about this virus and how it's transmitted. So I can tell you that right now, at this point in time, first of all, what we wear. So we're wearing scrubs that the hospital provides, and they launder it over there. So when we wear our scrubs, we leave the scrubs there and we change into clean clothes when we go home. And the hospital provides that for us. The hospital has also provided protective face shields for the eyes and for the covering the mouth and the head, as well as regular masks that we're supposed to wear everywhere at work. Now, those masks are used for us wherever we go on non-coronavirus suspected cases units, or even in the physician's lounge or anywhere else in the hospital. And then we have personal protective equipment and units specifically that have been created. Certain whole floors have been evacuated and made into coronavirus specific floors. And the rooms are completely negative pressure rooms. Just like tuberculosis, the same kind of precautions, even more so, because now we are having N95 masks, which is airborne precautions. We have face shields. We have double gowns, and we have double gloves, and we have what we call a donning and doffing buddy to help us take that equipment on and put that equipment on and take it off. So we also are doing phone interviews, so we are minimizing the time we are actually exposing ourselves to the patients.
Okay, and in this time when you have a patient who has symptoms and who doesn't have symptoms, how do you differentiate in the treatment of those two kind of patients?
You mean people who come in?
Yes. Yes, at the hospitals, yes.
So if a patient does not have symptoms and, for example, is coming in with something else like infection of the leg, we still are, the way we are treating everybody in the hospital, including my colleagues, including ourselves, we're treating as if everybody has the virus and can transmit the virus and can be a carrier for the virus. So imagine that we think that everybody around us, including the patients and the doctors and nurses, is infected and we are infected. That's how you protect yourself from this virus. So those patients also, when we enter the rooms, we are wearing regular masks and shields. We are being very cautious with hand washing, extra cautious. We're wearing gloves. When we're leaving the room, we are taking every step possible to minimize any kind of transmission from the prior encounter when we go to the next patient room. And I already told you about the kind of steps we're taking for patients who we are either suspect have coronavirus or are actually positive.
So this is what precautionary measures you are taking at the hospitals. But what about when these doctors, these nurses, these buddies, these technical staff at the hospitals, where they expose themselves unwillingly to this virus, and when they go back home, of course the life is not the same in the hospital, outside, at the home. How and what kind of precautionary measures you take when you go to your homes, to your houses, and how you protect your loved ones, the people that you live with, your partners, your parents, your children?
So first of all, as a healthcare worker, I know my risk is higher than the regular population. The hospital is a place where you can get very high virulent load, especially if you see patients day in and day out, even with all the proper precautions. The way I do it, and most of my colleagues do it, is I mentioned we wear scrubs at work. When we go home, we change those scrubs, into a clean pair of scrubs or regular work clothes, home clothes that we wear normally, like pants or regular shirt. When I leave the hospital, I take disinfectant wipes. I clean my phone, my car keys. I clean the steering wheel, the outside of the car, and before I enter my house, I leave the shoes that I'm wearing in the car, because those shoes the coronavirus has known to be survived on those shoes for up to 5 days. Pretty scary to think about it, but that's what it is. So before I actually enter the house, I go to the garage. I make sure, even though I've changed my clothes, I make sure that I take a disinfectant wipe and I wipe any surfaces that might again have been in touch with the outside world, or even if I have any, just to make sure. When I go in, I go straight to my room. I take a shower myself from head to toe, and again change into another set of clothes. I personally, because my mother is living with me, and she's in an age group where she's very vulnerable, I have made the personal conscious decision to separate myself from my family. It's a very, very heartbreaking, hard decision, but I want to keep my loved ones safe. God forbid, in the event that I am a carrier or I get sick, I don't want them to suffer because of that. So I use paper plates, which are my trash is separate. I launder my own clothes, and I wash, clean everything after with wash, hand washing. Everybody in my house is instructed to hand wash multiple times a day, and no face touching, if at all possible.
So this is a very difficult routine of life that you are into, and the people who are not at the forefront of this fight against coronavirus, the people who do not work in the hospitals, what do you want to say to them? The common people who are, of course, being locked down at their houses, but they're still, they're going out and they are exposing themselves to the dangers that we have in the air and everywhere. What suggestions or advice would you give to people right now who are, going through these times, the common people?
Well, please take it seriously. It's real. It's not a joke. It's getting worse. When people tell you to do social distancing, when people tell you to stay inside, when people tell you to wash your hands repeatedly, when people tell you, if you suspect you're getting sick, to not expose yourself to other people, it's very real, because our hospitals are going to get inundated if we all don't flatten the curve. If we just keep getting sick and infect people who are much more vulnerable, the immunocompromised population, the elderly population, younger people who have asthma or who have other chronic diseases, then you're creating a scenario where, because of your own self-centeredness, you're letting people die, because we will run out of ventilators if the virus runs unchecked. So take that very seriously, first of all. And just because you're inside, there's so many other things that you can do to keep yourself preoccupied. You can connect, you can find ways to improve yourself. You can meditate, you can pray, you can eat healthy, make sure you exercise, and keep your mental sanity and mental health intact. So all those are really important things to do. And you'll be helping us by staying inside. So let us help you by helping yourself.
All right, Dr. Fatima, of course, you are doing, a service to the community, and a brave thing, of course, keeping your work, ahead of your family and your loved ones, and you are giving the ultimate sacrifice at this time. So, anything else you wanted to add in this, advice or, suggestion to the people?
My suggestion to the people is to keep yourself informed, and just make sure when you're reading news, you're reading it from credible sources. Don't just go. There's so much misinformation on the internet, on social media. So make sure your information is real. The hand washing like I told you, social distancing. If you have loved ones who are vulnerable, make sure that you're also not just responsible for yourself, but try to also help others be responsible by, if you see behaviors that you don't agree with or you think are dangerous to the other people, you should call them out on it, and you're doing a service to the community. And just keep your spirits up. We will fight this. I do believe it, but we need your help. The frontline workers, the grocery workers, everybody else who's going out there, because we want to keep the community safe. We need your help by staying inside, by doing your role. So please help us do that.
All right, Dr. Fatima, thank you so much, and thanks for your time.
Thank you very much, Sakib.